Inviting me and my team to speak today. It is truly an honor to be here. So, as Arunima said, yes, I have known her for some time, and it's really nice to reconnect and to be able to bring our courses across to you. So I'm going to share my presentation to you, and we can have a look at the pathway, what it includes. So as Dr. Arunima was mentioning, I have been in the UK for some time. I moved here around 2006. And of course, I went through the same ORE pathway to be here. It has been a struggle, and as Professor Som said, that it's not an easy journey, but it's definitely worth it at the end. Because we struggled so much to get to this stage, that's why I think academics has become such a big part of my life. And to be honest, I thought I'm going to teach for a couple of years and then continue my private practice. But it's been so rewarding to help so many overseas dentists like myself come from various different countries and settle in the UK. And then to see them do really well has been so rewarding that a few years ago, I decided to start my own academy. I've been backed up with a lot of teaching experience before that, which has helped tremendously. And of course, we have reached a stage where we are sought after by academies and institutions around the world to collaborate with them and to bring our courses abroad as well. So our pathway is based on the fact that it's not an easy journey, but we want to make it more accessible to everyone overseas, dentists like us. Not only dentists, we also help dental hygienists and then dental therapists to move to the UK. So I have been here since 2006. I've worked in private practice, but currently I mostly teach. And as Arunima mentioned, I teach in the College of Medicine and Dentistry in Birmingham on a master's program, which has also been very rewarding and very eye-opening to see that so many clinicians who are so capable around the world could benefit in a better career if they wish to move to the UK. So to talk a little bit about our Phoenix Dental Academy, it was founded in COVID, to be honest, in the middle of COVID. It has come out of kind of requests from my past students, because I left my old academy where I used to teach during COVID. And I love teaching, so all the requests were overwhelming, and it instigated me to start my own academy, which has been very fulfilling. It has been, to be honest, the right step, and we have helped thousands of dentists come to the UK. I've been teaching for over 10 years now, and I think I've seen over 5,000 dentists from abroad who have come for the ORE, passed their ORE, and are now doing tremendously well here. Some of them own multiple practices around the country. They are doing extremely well, getting loads of awards for their work, for the recognition that they are getting is really fabulous. So we not only help overseas dentists register by preparing them for the exams through our courses, but we also have collaborated with over 900 practices throughout the country to help our students get suitable positions with surgeries around the country. These include independent practices, we have corporates. One of the largest corporates also in I think Europe is part of our collaborative team. We are also now looking to join other corporates, similar corporates, who we will work with more closely, so that once our overseas dentists pass the exam, we can offer them suitable opportunities in a safe environment where they can grow in their professional career and excel as well. So these are our roles. So we have courses to prepare for the ORE, for the LDS. Both these lead to registration in the UK. We also help in registering overseas dental care professionals who could be hygienists or therapists. This route used to be open to overseas dentists as well. Overseas dentists could register in the UK as hygienists and therapists, but this has closed just recently in March of this year. Because of this, of course, there's a lot of people who now are going on the ORE pathway. UK needs a lot of dentists, so this pathway is really a very, very good option. There used to be, so the exam itself, which we'll talk about in a few moments, is conducted in 2 parts, the ORE. And now they have increased the number of spaces at each exam, increased the number of exams in a year, so that they can accommodate more overseas dentists at each exam. So this is a very, very good time if you're thinking of moving to the UK, because there is a high demand of dentists here. So this is the time when you should really think about doing these exams and moving to the UK. Of course, there may be a time when they have enough dentists and they slow down the process, but I don't think it's going to happen very soon. In the coming years, I think the opportunities are going to be even more. We have courses to prepare for the ORE and LDS. We have courses for dentists who have just registered as hygienists and therapists. We have courses even after you register as a dentist to help you start your clinical practice, which is called our Return to Practice course, which kind of refreshes your skills, but also makes you aware of the dental regulations in the UK, which are quite strict, a little bit different as it differs in different countries. So our courses help you kind of find your feet and start your practice in the UK. Of course, any dentist is welcome to join our courses, even if you are abroad, you want to travel to the UK, you want to learn a few more things, you're more than welcome, obviously, to join our courses at any time. A lot of our courses are available online, so it makes access very easy for everyone who wants to attend from across the world. And these courses have become really, really popular, and we are one of the leading providers of ORE training online. And all our courses, even the hands-on courses, are available as distance learning courses. This sets us apart, to be honest, and we have pioneered this as we started during COVID, and obviously everything was online, whereas with other providers who were already existing, most of their courses were face-to-face, and it took them a while to realize the benefits of online teaching, but still, I think it hasn't really caught up with them yet. So we are still one of the only, I think, providers of ORE online courses. We also have courses to prepare for other UK exams like the MFDS, the MFD exam. Dr. Faria will enlighten us a bit more about all these courses. She herself has done the MFD exam, and she is one of our main tutors who teaches across all our courses. Myself, I mainly teach the mannequin skills courses, which I have been doing for over 10 years. And our courses are known to be one of the very best in the country. Obviously, all our content has been developed to a very, very high standard because it has been developed in the view of teaching university students as well. We have now, in the coming year, in 2024, we will be having courses which we can integrate into university teaching as well. And we have been speaking with multiple universities around the world, especially in India and Pakistan and Nepal, to integrate it into their teaching system, which might be somewhat beneficial if any university is looking to do that. Our tutorial team, we have around 10 tutors who teach all our courses. Everyone specializes in a different field, and they focus on their particular courses. Most of our tutors have either a master's degree or they have some postgraduate training. In the UK, the trend is slightly different. We do not have as many postgraduate dentists. We have more dentists who focus on skills more than academia. And for that reason, of course, here, the main thing which is valued a lot is your experience and your skill. So it's very important, obviously, if someone has qualified from abroad and has done a master's program, well and good. Of course, here you would be able to work as a dentist with specialist interest in that field, even if you did not register on the specialist register. So it's not a major problem because UK is very accepting of dentists with specialist interest, even just general dentists who have a lot of experience and who are very competent in a particular field. They can kind of take that area of their skill forward very easily in a private setting, or they can work in a national health service setting. Going forward, this is a little bit about our academy, which we founded in 2020. We are innovative on our online platform, as I mentioned earlier, for ORE, for LDS, MFTS, and other courses which we deliver worldwide. Our delegates, they join us from worldwide. Even for our face-to-face, in-person training, we have delegates on every course who have traveled from across the world to come and join our courses. So we are really proud of what we have achieved in these years. And of course, it would not be possible with our amazing team of all our dedicated dentists who we have had from the very beginning. We definitely believe in forward thinking and to provide the best in education. And we also support all our dentists in their journey, not only to pass these exams, but also for job opportunities and get the best out of the clinical practice here, because of course, coming to a different country, moving home is not easy. And we do support everyone, not only just to find a job, but also an emotional support and a backup system for all our delegates who come from around the world. Of course, as I mentioned before, we have a lot of dental therapists and hygienists also coming from abroad. We help with the registration process as well. We have a dedicated registration team which looks after our dental therapists and hygienists who come from abroad. So if you have anyone who has, say, registered as a dental hygienist or therapist abroad, the way it works is it's an application process to the General Dental Council of the UK. You have to submit the syllabus and certain documentation, and you could register here without giving an exam. And that route used to be open for dentists, but now is closed. But there are a lot of universities who provide undergraduate training, BDS training, who are contemplating making this short program a part of the BDS program. So we have had universities who have asked the question if they did include the syllabus of dental therapist or hygienist training into their BDS program, either in the final year or even in their internship year, and give their students a double degree like a BDS and a dental therapist diploma or a dental hygienist diploma. Would they be able to register here, work here, and then of course pass their ORE and register as dentists? And the answer is yes, they could. So this is something obviously which is of very big interest to some universities abroad. And of course, if your university is looking for something like that, we can have a word about it and maybe join that scheme as well. So these are in general our courses. Of course, we have tailor-made courses to suit each delegate as well. So it's not a strict course that you go and attend and you're not going to get what you need, because everyone's different. We believe that education should be tailored to each person rather than a generic training that is given to everyone, because this type of training which we provide is after your undergraduation. So everyone could be at a different level, you could have a different understanding, you might have your strong points, your weak points, and our tutors are here to tailor the courses to each person. These are in general our courses, which are main courses, ORE courses, which is the Overseas Registration Exam Preparatory course. LDS is the License in Dental Sciences, which is actually a diploma which is granted by the Royal College of Surgeons of England. MFDS, which is for higher education, MFD courses, which Dr. Faria is going to tell us more about. We have our hygienist and therapist courses, very, very instrumental for those who are starting their clinical practice in the UK. They have been very, very popular, and we have been one of the leading providers of these courses as well. And we pioneered some of the courses as well, so they have been developed in the best interest of our overseas colleagues, which obviously not many people understand where we come from, our background, how our clinical practice may be in different countries. And that's why we have become so successful, because all our clinicians and all our tutors have gone through a similar process at some point or the other, and they really understand where our overseas delegates lack or where the understanding may be slightly different, and help them to come and practice here and become successful here. We help with recruitment. We provide further CPD courses for professional development, which is obviously a mandatory part of UK dentistry. We also have registered in the UK as hygienists and therapists and dental nurses as well. A lot of our delegates who have come from overseas. So a dentist could technically work as a dental nurse in the UK while they are preparing for their ORE exams, if they are on a visa which allows them to work here, or even if they come as a student on a master's program, they could work as a trainee nurse. So we help with all these opportunities, and hence we have a complete pathway to the UK. Your journey may look somewhat like this. So we have our ORE Part 1 course. We have then once you've passed that, you give your ORE Part 2, you register as a dentist, and then after registration, you have options. Either you can work in a mixed practice, which is a National Health Service practice, or you can work purely as a private practice dentist, or you could go for a hospital-based role. Generally speaking, obviously in the UK, you have the National Health Service, which is subsidized by the government. The government pays part of the fee for the patient, and the patient pays partly. So it is cheaper for the patient, and it's very, very popular. And to work as a dentist on this NHS service, you need to have something which is called a performer number. A performer number for an overseas dentist is achieved by doing some work under supervision. It used to be called PLVE, or Performers List by Validation of Experience, but now that has been kind of abolished, and it has been replaced by just a menteeship period, where you will be working, but under the supervision of a dentist who already has a performer number. This period may range from 3 months to a year, depending upon your experience, which will be individually assessed. We help with jobs for this as well as a mentee dentist. Or you have the option, after you register as a dentist, without a performer number, you can work in any private practice. So as a private dentist, providing private treatment, you can work anywhere. So if you are a dentist with a lot of experience, really good work, you're confident in providing a range of treatment, you can apply for a private role in dentistry. People have done really well even in private dentist roles. Hospital-based roles are another option. Of course, these are quite competitive. You have to go for an interview, which is a competitive interview, and after that, you could be selected for one of their positions. The departments mainly which are always advertised are oral and maxillofacial surgery. There are other positions which are advertised on a lesser kind of availability, to be honest. But if you are intending to go into hospital practice, you can go directly once you are registered without doing your mentee dentist period. So these are the opportunities which would come after your preparation. Of course, before starting your journey, you would have to have completed your BDS, received your degree, and then we can even help you apply for the ORE. You need to first apply to the General Dental Council to appear for the exam. Once that application is accepted, then you are on your path to the ORE. The ORE bookings open once in a while, and you will have your special portal on which you will log in, which is given by the GDC once you register with them. And on that, you will be able to book any courses through your portal, any exam through your portal, which could be for the part 1. Once you have passed your part 1, then you are free to book your part 2. It is extremely essential to be very well prepared. So our courses prepare you in a really methodical manner. They are all streamlined to prepare you for the exam. The syllabus given by the GDC on their website is very vast, and we have now formulated our courses to an extent that we can guide you in the right direction. You know what you're going to study, what are the important topics, and you can pass your exam more easily, because obviously you want to put your energy into the right place and you want to give the exam to have a positive result. Yes, we all require the knowledge of dentistry, which of course we already do have. If you feel like during, when you're preparing, you need extra knowledge for yourself, of course, you're free to prepare that, but we don't have to go through each and everything which we learned in our 5 years of dentistry in order to give an exam for the ORE Part 1. So that's why we have streamlined our courses. It has lectures, we have special handouts which have precise information, and also we have the question banks, MCQs, and that's how our courses are formulated. Dr. Faria is going to talk more about the courses and the structure in a minute. And let's go on to the next part, which is the process itself. So this is what your process might look like. Your application to the GDC for the ORE Part 1, plus you're going to do your Part 1 preparation side by side. The application process does take a little bit of time, so we don't want to waste our time waiting to be accepted. We rather start preparing for the exam. Then we go and we book our exam, and we obviously, hopefully we pass it. Pass rate for the Part 1 is quite high, so I expect that everyone should be passing that quite easily. And then right after each Part 1 exam, which is always, right now it's only conducted in London, and we normally have our Part 2 courses, which we schedule just after the exam, so that within the same trip, you can come and attend the course, go home, and we will support you throughout to prepare for your exam. So you'll do your Part 2 preparation course. Once you're ready, you'll book the Part 2 exam. Once you've passed that, we can register as a dentist and work as a dentist in the UK. So this is the pathway that you would follow if you were an overseas dentist. Once you're registered as a dentist, of course, then we will help you find a suitable position. All our partner practices, they offer sponsorship visas as well. So all we would need is your CV, and then we would find a suitable position for you. You would have your interview with the practice. If you obviously want to visit the practice, we arrange a practice visit, either in person or a virtual visit of the practice. And if you're happy with everything, then you would receive your contract. We do obviously advise that while signing any contract, you do take some legal advice if you feel that you cannot understand it very well. Although all our partner practices have very, very simple contracts, there's nothing written in a language that you can't understand. You'll be able to understand it without any alternative meaning to the wordings that are written, which is the great thing about those contracts. And normally the contracts are for around 3 years. Some have extended contracts for 5 years, after which, of course, you can apply for indefinite leave to remain in the UK, which is the advantage of having a longer term contract. So if you decide to come to the UK on, say, a student visa, you're doing a master's program, or you are coming to the UK already as a dependent, you have a visa on which you can work, then we do have also with our partner company an NEBDN diploma in dental nursing course. This course enables you to work as a trainee dental nurse in the UK while you are preparing for your ORE exam. And then, of course, this gives you a very good insight into UK dental practice. You will be very familiar. It will help you with your exam preparation. And also, of course, when you start your clinical practice, you would know mostly everything about the legal aspect, the working of the surgery, the softwares they use, the infection control protocol they follow. Everything will be very, very clear in this pathway. Of course, the pay of a trainee dental nurse is not much, and to be honest, it's not done like as much for the money as it is for the experience. If you hold a dental therapist or hygienist qualification overseas, then we can help you register with the GTC, and we can help you find a suitable position with a sponsorship visa, and you can move here, start working as a therapist or hygienist while you prepare for your ORE. And of course, we assist with the ORE preparation. Once you have completed that, the pathway is smoother. It's more easier to get a job because everyone is looking for a dentist, especially if you have good skills, a good CV, good experience, then it's much easier to get a job here. So I would say that if you are going to go on the ORE pathway, then keep working in your home country, because your experience and your skill is going to be invaluable when you move here, because that is what everyone is looking for, a well-trained, someone with a good experience, someone with good skills. So having a good portfolio is also very, very important. So you can start documenting your work, having consents for that, so that we know that, your patients were happy in providing that, which also is obviously a very big part of UK dentistry. And if they see that you can do things in their way, they will be much happier. We do have sessions also online, which are to introduce our new clinicians to NHS practice. If you are planning to move to the UK, that is something which you might like to join, because it will give you a good insight into how UK dentistry works. So even before you start your journey, maybe it's something which will enlighten you and let you also help you in deciding whether this is the right step for you or not, because of course it's a big step. We do help, if you have questions, of course, you can always contact the team and we can help answer your questions, put your mind at ease, and help you decide whether it's the right path for you or not, because of course, one path will not suit everyone. We may have different expectations, and we can help you realize if these expectations will be met or not. So this is about our tutorial team. Of course, we have very experienced dentists on our team who are constantly updating themselves. As is Dr. Faria, she is working really hard at the moment on her master's. We have our other tutor, Dr. Saima, working on her master's. We have tutors who are oral surgeons with a lot of experience. So we have a variety of dentists on our team, of clinicians on our team. A lot of them teach even at university level, teach for different academies as well. So we don't limit our tutors to growing. Of course, we want everyone to grow, and hopefully we can help all of you as well in some way. So these are generally in a general overview what Phoenix Dental Academy does. We are going to be expanding a lot in the coming years because we have so much demand from universities overseas like yourselves. who want to collaborate and do something better for their students. And so do we. We have founded our academy to help overseas dentists like ourselves, but I think to give back and to help other universities also formulate programs which are comparable to UK education, which will set you apart, like which will set universities apart, that your students could just come here and start doing their exams without any additional preparation, because they're trained in the exact way as they would have been here, would be something. Of course, that is what we are trying to achieve, to collaborate with as many universities overseas as possible to make this happen. We are going to, of course, now go through our courses, the exams, give you more insight on the pathway. Dr. Faria is here with us. She's a very valuable part of our team. She has been with us since the very beginning of our Phoenix Academy, and actually even before that we have worked together. I've known her for many years now, and she teaches on our ORE Part 1, ORE Part 2. To be honest, I think on most of our courses. So she is a great all-rounder all over, and she is very supportive, very knowledgeable. Our Part 1 courses especially have extremely very, very good feedback for her teaching. Dr. Faria, I think I would like you to take over from here to introduce us to all our courses. Please do introduce yourself. It will be really good to hear more from you, insight about our courses and the exams as well. Thank you, everyone. Thank you for me.
Thank you so much, Dr. Anita. Thank you for the brief introduction that you've given about me. And I just wanted to say thanks to Arunima, and sorry if I'm pronouncing your name wrong. And I think there's Prof. Som as well. So thank you so much for inviting us today. For those who don't know me, my name is Dr. Fariha. And as Dr. Anita said, I know Dr. Anita for since a very long time. I graduated myself in 2017 as a dentist from Pakistan. So again, I am an overseas dentist as well, working in UK. So when I graduated, I moved straight to UK immediately after my internship. And that's when I started joining the ORE courses. And that's when I met Dr. Anita in 2017, long time. And as she explained before, that there was a big demand of her courses, and there were vast number of students attending her courses, and the passing rate was really high. So she was being pushed to open up her own academy, and now here she is, and she's really successful in that. I did all my preparation with Dr. Anita initially, passed my ORE and started working. And I've been in clinical dentistry in UK for over 6 years now. Also, I'm doing my MClindent in fixed and removable prosthodontics from King's College London, which I think is also a really great opportunity. And as a side business, obviously, I do work for some orthodontics teams as well, like Invisalign and clear aligners. And I also work with Dr. Anita in teaching. So I've got, again, vast experience in teaching. I've been teaching since over 6 years now, both ORE Part 1, ORE Part 2, and then I also teach the Royal College exams. So when we talk about Royal College exams, as Dr. Anita said, there are some exams called as MFDS, NJDF, MFD. So I've given these exams and I've passed them. So I teach on those exams as well. Usually students have a question about what benefit will we have if we pass these exams. Is it really important or necessary to pass these exams? So I wouldn't say it's necessary, because it doesn't give you a license to practice in UK. The license only comes from either of the two exams. One is ORE and the other one is LDS. However, if you do these exams, you have greater chance of getting into master's program, like I am in MClindent, and you get a great chance to get into any training program like hospital jobs. So if you want to apply for any hospital posts, any training posts in the hospitals, then it's really important that you do your MJDF, MFDS or MFD. The other question that I very frequently get from my students is which one should we do, whether MFD, MFDS, MGDF? The simple answer to this is any one of them. So it does not matter if you've done all three of them, just one of them, it's fine. I did them all because I wanted to teach them. So until unless I've myself not sat in the exams, I will not be able to give adequate teaching to my students. That's what I believe. That's why I did them. But even if you pass just one of that exam, you are absolutely a perfect candidate to apply for the training programs in UK. Or for further masters, for example, it can be just simple masters, full-time, part-time, or masters in clinical dentistry as well. Does anyone has any questions so far or anything specific before I move on to my slides and just start sharing my content? Or Arunima, if you're there, you can let me know if there's any question in the chat box.
There are a couple of questions in the chat box, but I think we will address them in the end. So
okay, that's no problem. That's fine, thank you. So yeah, we will keep an eye on your questions. Arunima is there as well, so she will keep an eye. So keep asking questions if you have any, and then we will be able to address them in the end. I'll start sharing my slides. Okay. Okay, so basically we were discussing about what is ORE. I hope you all can see my screen. And Arunima, sorry, can you please confirm if you can see my screen?
Yes, we can see your screen.
All right, thank you. So I will briefly be discussing about all the courses that we are providing. So obviously, as Dr. Anita said, that this academy was founded in 2020 during the time of COVID, but we have developed a lot. And I have been teaching ever since this academy was founded. And obviously before that, I've been teaching these exams as well in different other academies. So ORE part 1 and 2. So there are two parts of this exam. This exam basically gives you the license to practice in UK. Part 1, as Dr. Anita said, has a very high passing rate. It's easy exam, just MCQ based, and there's 50% that you need to achieve to pass the exam. So it is an easier exam. However, when you will open up the GDC and you see the syllabus on the website, it explains a vast variety of the subjects involved in part 1. And this makes it really difficult, and candidates start thinking that maybe we need to buy lots of books, maybe we need to consult so many books for this exam, and it's difficult. So after lots of hard work of about 6 to 7 years now, we have finally successfully now made very concise, very self-explanatory notes on every topic that is important for ORE part 1, and that basically comes in ORE part 1. So when we are teaching in ORE part 1 lectures, we give you those lectures which we have already created from several books, so you don't really have to worry about which books to buy, which books to read from. Even if the pictures have to be taken from Nature Atlas, we have taken them and added them into the lectures. So you basically do not have to open any book. There are certain areas in the lectures where we ourselves inform you that this is what we want you to do from this book, and that's it. So the whole purpose of explaining you this is that the part 1 course itself has got all the information that you need to pass the exam. So you do not have to worry about books. Coming to the part 2 exam, part 2 exam has got 3 parts. So its first day we have the OSCEs, second day we have the mannequin exam, third day we have the treatment planning and medical emergencies. So I will be explaining them to you later on. So we have again planned our courses in such a way that we have actor OSCEs, skilled OSCEs and written OSCEs planned exactly the same manner how they come in the exam. We have actors sitting in the actor OSCEs. They will act with you in the same way as they will act in the exam, which actually prepares you and gives you a lot of confidence before you actually sit in the exam. Then part two, the second day is the mannequin, and Dr. Anita is really competent in teaching the mannequin skills. As I said, when I reached UK, I had no idea which course to take, but luckily I took her course for mannequin, and I could easily pass my exam because I think because of her own experience of teaching this for a couple of years, And because she herself has given this exam, she has got a lot of knowledge. And basically, we cover everything in the mannequin part of this exam, everything that you need for ORE. Day 3, again, we have the theoretical teachers like me, and there are some others which will teach you on your medical emergency skills, how to perform BLS, how the guidelines have now changed in UK after COVID for performing BLS. We teach everything. We teach you how to deal with every medical emergency. And then on top of it, we have got all the equipments, all the skilled OSCE equipments, as well as the medical emergency equipments, which are desired for your preparation in the exam. So once you prepare with us, you can keep coming back to us for revision sessions and utilize the material and get yourself really self-equipped and confident with the preparation. So day 3, medical emergencies and treatment planning, we teach you everything that you need for the exam. Same goes for the LDS exam. LDS is another kind of licensing exam. So if you don't want to go for ORE route, you can go for LDS route. LDS previously used to have 2 parts, 1 and 2. Now it has got 3 parts, 1, 2 and 3, which has actually made this exam a bit more easier. So part 1 is more like theoretical with MCQs, 2 is more like OSCEs, and 3 is more like mannequin skills. So it's more or less, the exam is similar to ORE in terms of the syllabus. However, the structure of both the exams is different. Usually students ask which one to give, ORE or LDS. It's very much personal preference. I've myself given ORE, Dr. Anita has given ORE. I've known maximum people giving ORE because obviously I think it has been an old exam and people have been giving it, and it has been just referred from one student to another. But there's no harm if you get LDS. In fact, if you give LDS exam, you get the membership from Royal College of Surgeons. So this is something, the added benefit that you get with LDS. So you get this with your name, just as you get MJDF, MFDS. So LDS will be there with your name. So for LDS, obviously, the preparation is a little bit different from ORE. So obviously, we know what are the differences in both the kind of exams. And we have tailored our courses in such a way that ORE basically focuses exactly on how the exam will come, and LDS preparation exactly focused on how the exams are conducted. For both LDS and ORE, the part 1 preparation is more or less the same. That is why we teach actually the same group. ORE, LDS students sit in the same group when we are teaching the part 1 paper. Part 1 paper, as I said, has MCQs, and we have made specific notes which we give you. We teach on those notes, and if there's anything extra that you need to do, that is something we tell on the day of the lecture. Apart from that, we also have sometimes, obviously because of the difference in the time zones, there are students who are unable to attend the online lectures for ORE Part 1 or LDS Part 1. We do have the recorded versions as well, so that you can listen to them at your ease, and whenever you have questions, you can ask them. So that's also something that we provide. The ORE Part 1 course, in fact, I would say also the LDS Part 1 course has got all of these subjects. You can take a screenshot of this if you want, guys. And so these are the subjects or topics involved and that are being asked in the exam, and we cover all of them in our lectures. If you talk about ORE Part 2 exam and LDS Part 2 exam and Part 3 exam, basically, as I mentioned before, Part 2 ORE consists of 3 days, whereas Part 2 of the LDS is mainly based on OSCEs, and it has a Part 3 which is based on mannequin. Whereas ORE has just one Part 2 which is based on 3 days. So it will have OSCEs, mannequin, and medical emergencies, and that treatment planning on last day. So this is just some introduction about our mannequin exam and our courses. So we've got a complete setup of mannequins, exactly same mannequins as you see in the exam. The exam is usually conducted in University College London, and the mannequins that they have got are exactly the same. Even in the LDS, if the mannequin exam comes, the mannequins are exactly the same as we've got with us, and the instruments, the techniques that we are using are taught in the exact same manner as you are expected to do so on the exam day. For ORE mannequin, what can basically be examined? So you will be asked for amalgam exercises, composite exercises, and root canal treatment. For amalgam exercises, class 1, class 2, and then they can ask for lining. For composite exercises, you will have class 3, class 4, class 5, and you can have a cusp buildup of upper posterior tooth. For root canal treatments, access cavity can come, canal preparation can come, canal preparation of single canal of a multi-rooted tooth can come, and followed by obturation of the canal. So obturation in the exam only comes for one canal, and the tooth that they give you is a transparent tooth. It has got obviously the nerves that they have made inside the roots. You're not able to see that transparent part because they try to block it and they try to mount that tooth in a cast, so you cannot see the roots, and you actually perform the root canal treatment and you have to take the x-ray of that cast so that you can see what you have done. But however, when you're preparing at home, of course, you can see that transparent part of the root, and we will teach you how basically you should be performing root canal treatment in the exam, what steps to follow, and what are the things that the examiner is actually looking for. So the courses are really very thorough, and we make sure that the focus is never deviated from what is expected in the exam. In the LDS exam, similarly, in addition to all of the ORE exercises, they can ask about large amalgam cavities and restorations, class 3 composite through and through. They can ask about amalgam cusp buildup, inlays. They can ask about onlays, 3/4 crown, class 3 cavities, peg laterals, plus any exercises of undergraduate level can come. So LDS does not have exact fixed syllabus of what can come in the exam. However, for ORE exam, you do have a fixed syllabus which does tell that these are the specific exercises and that is how what they are expecting in the exam. So in that manner, when students come to me and they are very much course specific, then I ask them to appear for ORE. If there are students who are ready to accept vast variety of preparations, they are happy if anything unseen or any unseen exercises can also come, then LDS is good. Nothing is basically unseen. Obviously, we have already done everything in the undergraduate and we try to teach you as much as possible on LDS. However, for ORE, the course is very specific and nothing comes beyond those exercises. So whatever is mentioned, only those things will come. So that is the major difference in the mannequin of ORE and LDS. So OSCEs, there are communication OSCEs, skilled OSCEs, active and written OSCEs. And as I said before, we exactly do the same acting, same skilled OSCEs assessment, same written OSCE assessment as it is done in the exams. We have got trained actors. In some of the OSCEs, you will often find me acting as a patient, and some of my colleagues are there as well. And we try to prepare you exactly for the exam scenario. This is some of the written OSCE examples. So for example, the prescription is the favorite question for both ORE and LDS Part 2 exams. They do give prescription writing a lot. So again, we will tell you, you don't really have to go through the whole VNF. We will explain to you what exactly you need to basically perform and what basically things you need to learn from that VNF so that you just learn what is required in the exam. And then, as I said, treatment planning and medical emergencies, we've got all the equipment, the COVID-19 guidelines, how you actually have to perform them. We have got so many students now who have given exams after COVID and they have passed. So we've got good feedback. We've got feedbacks from students now. So we make sure that whatever we teach is up to the standard and what is expected in the exams from you all. This is just a little bit of brief about our courses. You're more than welcome to take screenshot about our ORE courses, Part 2 mannequin, LDS, mock courses. It's all information is given here. And there is one more slide which I would like you to take a screenshot on for Royal College exams, basically. We have got some additional courses like dental photography, anterior and posterior composites, rubber dams, and dental nursing diploma. You can basically go through these as well. And if you ever need to attend any of these, you're more than welcome. So that is all from my side. Thank you so much, everyone, for listening. And I will...
Arunima will take the question answer session, and we are really short of time, but I think we'll take 2 questions. Arunima, please carry on.
No problem.
Okay, so we have a couple of questions.
Arunima, if you don't mind, can I access the chat box by any chance? I can skim through them quickly and answer them.
Yeah, Prof. Sohn, can...
Yeah,
yes, I can. I can see the question. I can see the question, yeah. Okay, so the first question is, give information practicing OMFS for overseas OMFS or general dentist. Dr. Surendra, is it worth to go and practice in UK who have master degree and work experience for more than 5 years of specialist practice in overseas? Can overseas OMFS specialists can practice academic? Okay, good question from you, Dr. Surendra. You wanted to ask that you have done a specialist, if you've done a specialist degree and you're recognized as a specialist in India already, or any other part of the country, any other part of the world, sorry, you can, it is worth coming to UK. Why? Because we had 4 students. They are on a consultant register in India, and they, after passing their ORE, there is a route, and we will try to get more into the details for specifically oral surgery. I'm not sure about OMFS, but for prosthodontics, I've got 4 students, which I can tell you of. These 4 students have basically submitted their paperwork to the GDC, and on the basis of their exams and their full-time training that they've done in India, they have come on the consultant register in UK. So they are now consultant prosthodontists. They have not done any training in UK, nothing. They've just submitted that paperwork. So there is definitely a route for prosto, but for surgery, I will have a look. However, for OMFS, the route is basically, you just need to pass ORE Part 1 and MFDS, and then you apply on the basis of temporary registration in the hospital. You get a job, and then you keep preparing for your ORE Part 2 and get full registration. So after passing ORE Part 1, you can be on a temporary registration and work in a hospital setting in the OMFS and finish the years of training. So it's about 3 years and then about 4 more years, I think, for full OMFS. And for oral surgery, I think it's about 4 years. So different, obviously hospitals have got different regulations, for example, different in Scotland, different in Ireland, but there is definitely a route. When you say, is it worth? I would say it's worth, depending on, obviously financially, the status is really far better here in UK, especially if you're on a specialist list. So I think that's going to work really well for you. Next question is, what is the process like for doing a postgraduate program in the UK? Must we still sit for? No. So if you want to do a postgraduate degree, you do not have to sit for ORE. You can just simply apply to the college or the program that you want to do the degree. All they need to see is that you are a practicing dentist in your own country. And that's all you need to prove, that you have license to practice. So Amrit Kaur, I hope I've answered your question. Is there a minimum work experience needed in order to sit for ORE LDS? It's just 6 months of clinical experience that you need, and obviously a certificate of good standing that, of course, you cannot get after 6 months of post-graduation clinical experience. So 6 months is really important, and if you have more, obviously it counts more, but minimum 6 months is important. So I think I've answered all of the questions.
Thank you so much.
Sorry, I've been speaking so fast, Arunima. I just wanted to make sure that I cover all the questions.
Okay. Thank you so much, Faria. Thank you, Anita ma'am, for this session. And it was, I hope it was helpful for all the students. And I really thank Prof. Sohn for making this work out. And Dr. Anita, Dr. Fariha, thank you so much. And I thank all the students for joining.